I'm here on a plane heading out to Amman Jordan for a couple of presentations. Come with me. Look who out here with. I came to visit this guy.
Thank you so much.
Awesome.
You want me to? I can't.
Well, welcome to Jordan, and here we are at Petra, ancient city with the Nabateans who live down here. Had a fairly sophisticated architecture and city planning right here in the middle of the desert, one of the many lost civilizations in the world. Petra, of course, it's a city of stones, more accurately sandstone that has been all carved. A few cities in the world that's been carved down from that part of walking though. Look at this, this is the city square behind me. Well, I went up this mountain with a Boston hat and came down with a Jordanian one. You know what they say when you go to Jordan, do what Jordanians do. One thing I can tell you actually is that this is a lot cooler than this. Allows more ventilation. Okay, now I have fully embraced the culture. So now I'm fully Jordanian.
Oh, yeah, why not? Endodontic Arabian.
That's right.
Welcome.
Oh my God, after that 10-mile hike up and down Petra, this really hits the spot. Edge bond. Thanks for all your efforts to putting this whole thing together.
It's a pleasure having you. We're delighted. I hope you're having a good time.
I had a wonderful time. Beautiful country.
Thank you.
Yes. So, show me your clinic, Hammo. I've heard a lot about
it
it.
will be my pleasure.
Let's go check it out.
Let's go.
Overdressed for this kind of temperature. 100 degrees, I think. You sure you have enough diplomas on the wall? I could.
So this is my clinic and I work here. I'm so pleased you are here. Let's go.
Well, Dr. Hammo, thank you so much for showing me your beautiful office here. And then this is where all the action is created, I can tell. Your cases on Facebook in different parts of the world have been quite famous, great following. And, one of the things I've noticed about your cases, first and foremost, thank you for inviting me to come.
You are more than welcome. I'm so happy to have you here.
I really appreciate you having me. The one thing that I've noticed about your cases that I think are probably the part I want to focus on with our viewers is the fact that you have excellent, meticulous follow-up. Because everybody can do beautiful cases, right? And they could work until the patient leaves the office.
I agree with you.
The key is the follow-up,
That's it.
right?
That's it.
And so I want to commend, first of all, what is your trick? How do you get these patients to come back? Because I'm trying to convince everybody to come back and they're kind of like, I'm too busy.
Every patient comes to my clinic. He should be informed that he has a free follow-up X-rays.
Right.
And this is part of our treatment. And we, to be in the safe side, we have to make the follow-up X-rays. So what we will do, we schedule him after 6 months, 1 year, 2 years, and 3 years. Then I will let my assistant to phone them, and I insist to tell my patient, this X-ray is for free and you already paid for it. So just we want to be sure everything is fine. Just come back and we want to take this X-ray. So they come here and they know previously they will not pay, and this is part of the treatment.
So that's terrific that you make the phone call, because that's a little bit, we always send cards and envelopes to say it's time for your recall. And we do say that it's free, but people are like, I'm too busy, the tooth doesn't hurt, I don't want to come back, and they're busy people. So making the call is important.
Yes, I think phoning is better. Why? They will feel you are caring.
Exactly, it's personal, and then the fact that the assistant says that it's coming from you, it's going to add a little bit of weight to it because you did the work, and it shows how that you care even without.
What I will do, I will let my assistant phone them and then send a message, and on the day of follow-up I recheck and then send it again, so they feel we are caring.
Perfect. Awesome. So I guess you have a couple of cases of recent recalls on these cases. So let's take a quick look at those.
Yes,
right?
please. So this here, I have furcation involvement, big periapical lesion. So I take CBCT for all my cases routinely. What I did when I took this CBCT, I found here we have perforation and we have here missed canal.
Wow.
So simply what I did, I removed the old fillings, cleaned them properly, and sealed the perforation. And here I believe in single visit root canal treatment in more than 90% of my cases. Then when I finished the case, I took another CBCT just to be sure we sealed everything, and I gave him follow-up X-ray after 3 months, then after 6 months, and as you can see here, after 1 year. So after 1 year, it's CBCT again with great healing, no signs, no symptoms. So this is what we do here.
That's incredible amount of healing that you have, even in the furcation. That goes to show a lot of times, if the furcation bone loss is due to endodontic origin, the bone can come back.
Yes.
If it's due to periodontal origin, that's when it's difficult and the bone may not come back.
But the problem, we do not know really which one. So what we do, we start with endo. So I always tell my students and my followers, let's start with endo. Let's give the tooth a chance. So I like what you always say, let's try to save teeth. Why not?
Let's save some teeth.
That's it.
So, okay, so that's beautiful results you achieved, and you filled that and you restored that as well very nicely. You're a restorative dentist. Okay.
Here we have a big periapical lesion.
Yeah.
And always in all time they always say this is a cyst or this is a big periapical lesion more than 5 millimeters, it will not heal. Now what we are trying to convince our colleagues, no, let's give them a chance. 90% of the cases, the problem is inside the root canal system. If we get rid of the bacteria, the body will heal. So what I did here, I made good root canal treatment, and as you can see here, the apex is, the lesion is big and the apex is wide. So I filled the tooth with biodentine here, and then I made the follow-up. As you can see, it's only 1 year. With 1 year, this lesion is 13 millimeter by 13 millimeter, and as you can see here, we have full bone regeneration again.
That's perfect. So this is another one of those cases that shows the size of the lesion, usually based on the studies, has been correlated with the potential for a cyst, but the fact that there is a potential for a cyst isn't necessarily a guarantee that it won't heal with a non-surgical attempt.
That's right, and the issue here, we could not differentiate either radiographically or histopathologically on the true cyst or the pocket cyst or the granuloma. So simply what we are going to do is just let's make simple root canal treatment and follow up. Right. With the follow up, and this patient, I told him we have to make follow up because he was referred from a surgeon. They want my permission to make surgery. I told them let's give it a chance, and as you can see, 1 year, everything back to normal.
I mean, it goes back to just removing the microbial burden inside the tooth and get rid of the biofilm, and the tooth can heal. Terrific. What else you got?
Here, it's a simple case, straightforward case. We have Periapical lesion, the tooth very rare mobility. But what I did, single visit root canal treatment, and as you can see, after 10 years, we have great healing. So I told my colleagues, it is endodontic is simple. So what you have to do is just get rid of what is inside the root canal system, and outside, don't touch it. The body will take care of it. Here, this is interesting case because we have external resorption, there is a mobility, but the patient was motivated enough, he wants to keep his tooth. So he asked if we can save it at any price. So I told him, why not? Let's try. So what I did, I filled the distal root here with the MTA and get a Berka with the sealer.
Right.
And you can see here after 4 years.
Yeah, that is amazing that the resorptive lesion was due to the presence of continuous biofilm inside the tooth. The body was trying to get rid of it. You clean the inside and you get the arrest of the resorptive defect. Unfortunately, when you can do your best for patients to heal the tooth, but if they don't do their part, in terms of brushing and flossing, like in this case, you end up with decay on the knees.
So when he came back, I told him in the follow-up x-ray, why you did not make the crown? He told me, because I was not sure it will survive. I don't want to pay extra. So when I said it's good now, please remove the decay here and make the crown. He promised me to do this. So let's see the last case here with this patient. It's a sad story because he went to a dentist. The dentist, he broke a file inside. And I always tell my colleagues, it's not a problem if you made breaking a file, but you have to know how to deal with it. So he broke a file, then he stopped and he placed a crown and he left the other root without doing anything. Right. So there is a swelling, the patient came back, he asked me what to do. So I told him, let's cut the crown and see what is inside. As you can see here, we have 3 canals. So what I did, I bypassed the broken file here, and fortunately all of them, they met at one foramen, and I filled the tooth. And let's see the follow-up after 10 years. So I made this follow-up for this patient every 2 years, and this is the last one here.
Wow, that's amazing. So it's beautifully handled, bypassing the file, and then finding the additional 2 canals. That's no easy task for you young people out there trying to do this. That's beautifully handled and very nicely done.
I believe endodontic is interesting. If we master it, we will love it.
That's it. That's the key, is to master your craft and enjoy the benefits of it for yourself, in this case also for your patients and the people that you work with. So wonderful. Dr. Hammo, keep up the great work, and look forward to seeing more of these interesting cases and recalls from you. The key here again with the recall is with patients that are really especially kind of concerned about, endodontic therapy, you leave bacteria behind, any of that stuff. The so-called the holistic dentists who say, root canals don't work.
Yes.
The answer to that is not to pull the tooth. The answer to that is to have frequent recalls.
That's it.
Because that's how you find out if it's healed or not. Like any other procedure, a percentage of these cases work. A large percentage of them actually work. Large lesions that could be 80-90%, right? And if you're in the 80-90%, why pull the tooth?
So give them the last chance before taking the last decision.
Yeah. The key is follow up and recall.
That's right.
Thank you so much.
Thank you so much.
I have energy.
Wow.
It's like oil.
Yeah, it's super heavy.
Yeah.
This is the Dead Sea.
Yeah.
The Dead Sea for a reason, because nothing can live in it. Super salty. You taste it.
You feel it, the water.
Woo!
Very.
Whoa. Feels oily, but it's not oil. It's just, I think it's such a super saturated salt content here. It's amazing. Whoa. It's out there, far out there is Jericho, and right over those mountains is Jerusalem. It's definitely oily. Too bad I didn't have my bathing suit, otherwise I would have gone for a swim.
Countries which they have the highest cancer rate.
Really?
So this is.
Hi, how are you? travel trip is finally winding down. I'm sitting here at the airport lounge in Amman, heading back to Boston. But I can't help but reflect what a wonderful time I had here, meeting so many great people, kind people interested really in education, great leaders, local leaders that really inspire other people to do their best in this clinical field that we're in dentistry as a whole, and endodontics in particular. Really happy to be a part of this community. I look forward to continue to travel and share these things with you. If you're in a place that I haven't been to and it has things that I can capture on video, make sure you invite me to come in and give a talk to you guys and share this with the rest of the world. For Real Dendo, I'm Ali Nasseh, and until next video, let's say something.